Today we're going to talk about PCOS, and we're going to talk about a couple things about PCOS, specifically the types of PCOS and things that you can do or talk to your doctor about in order to think about and treat your PCOS naturally, because there's a lot of misinformation out there about PCOS. And I think PCOS should have a very different approach from what the traditional medical model is. So first of all, let's talk about what PCOS is. So PCOS is a condition where you have a variety of symptoms and you have to meet a specific set of criteria. And the criteria is that you have irregular cycles or that you don't ovulate, that you have male pattern hair growth, which usually occurs in the chin area, or it can occur other parts of the body, or you have actual cystic ovaries upon ultrasound. Cystic ovaries upon ultrasound. So you have irregular cycles, you have evidence of androgen symptoms, like having increased androgens on a blood test like testosterone, DHEAS, something like that, or you have the male pattern hair growth, or you have the polycystic ovaries. So I'm looking down here because I have my notes so I stay on track. So that's the diagnostic criteria that was established in 2003, and it's 2020, so that was 17 years ago, and we're still using the same criteria, and really the treatments for PCOS in the conventional community really haven't changed. And what generally happens for my patients is that I work with a lot of women that have period problems, and some women will come into me with a diagnosis of PCOS, or they will be a long time struggler with PCOS, or they have regular cycles and they don't know what the heck is actually happening. So very, very common. So I wanted to define what PCOS is before we get going, because PCOS can end up being a little bit of a catch-all term, and it ends up not being well defined. There are lots of women out there that believe that they have PCOS, but they don't actually have PCOS. They have something different. So we're going to talk about that. So again, to have PCOS, to be diagnosed with PCOS, you need to have 3 different types of symptoms that are not explained by other things. So this is menstrual irregularity, whether your cycles are all over the place, you're going long periods between cycles, or you are having instances of not ovulating. You need to have different male pattern hair growth called hirsutism, or you need to have evidence of hyperandrogenism, which is having elevated levels of androgens in the blood like testosterone or DHEAS. And you also have to have polycystic ovaries upon an ultrasound, which most of us are not getting ultrasounds. So sometimes this is a part of the criteria that is kind of left off. So you need 2 out of the 3 to get diagnosed with PCOS when there's no other cause for all of those symptoms. And that's really important because I feel like there are a lot of different causes for those symptoms. There's many different reasons why you can have irregular cycles. There's many different reasons why your testosterone could be elevated. And there's many different reasons why your ovaries could look cystic. So, and I'll explain that one in a little bit because I'm sure that just blew everybody's mind. But there's lots of different causes for these. So just because you have those doesn't necessarily mean that you have PCOS. And what you have determines how we treat it, right? So very, 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 very important. So keep all of those things in mind as we are talking today about this. And for those of you that are just joining, hello. I'm looking down because I have my outline so that we stay on track tonight. So let's talk about some symptoms that women that PCOS commonly have. So number one would be period problems, and this is usually some sort of menstrual irregularity. So these are women that are skipping several cycles in a year, where when they don't know their cycles are going to come every month, so they're not having a monthly cycle, or they're having cycles where they know that they're not ovulating. Those two kind of come hand in hand, and usually we figure out that they're not ovulating with some tracking methods that we can talk about too. I feel like this topic is super jam-packed, so we might have to do two separate lives for this, two separate videos for this. Most women that have PCOS have either acne along the jawline, neck as well, sometimes chest and back. And they also have the male pattern hair growth, really common. You can also get male pattern hair growth around your nipples for women. And most women, it's all around here and down here, most commonly under this area. And a lot of women tend to pluck it and get rid of it, so it's not a problem. But if you're getting dark hairs in this area, that's not normal. So that's a big symptom. And of course it's super concerning because we're not supposed to have hair there, so it can be really embarrassing. And that's one reason why women tend to come and see me for PCOS, because there's a cause, and I'm all about finding the cause. Another big one is having issues with weight. So weight that's going up and down. Some women that have PCOS are actually obese, or are out of their BMI range, or have an extra 20 pounds or so. It really depends on the reason why they have PCOS in the first place. And some women have hair loss that have PCOS, and the reason why is because the high androgens can affect your hair follicles and actually cause your hair to fall out. So that's something to think about. But those are the most common symptoms for women that have PCOS. If you're a woman that has a lot of PMS with cycles, or you have a lot of pain, or you have a lot of cramping, those are not necessarily PCOS symptoms. PCOS diagnosis does not typically go along with any sort of presentation of pain with your cycles. So if you're the woman that tends to get a lot of pain with your cycles, most likely PCOS is not a problem for you. That being said, you can have really gnarly PMS with PCOS, so many P's. You can have premenstrual syndrome symptoms. So you can have bloating and breast tenderness and mood issues and irritability and heavy cramping with PCOS. But women that tend to complain of that the most, usually PCOS is not their main symptom, or is not the main problem, I should say. So if you're watching this video and you're thinking, I have a lot of PMS and I have a lot of pain, PCOS might not be the diagnosis for you. So just think about that. File that away in your mind. You might need to pursue a different area. So let's talk about the different types of PCOS, because that will facilitate our idea of treatment. So before I get into that, the issue with PCOS that I dislike in terms of the treatment and the diagnosis of PCOS is that most of those symptoms that we just talked about can totally be helped and prevented by natural medicine, and require a holistic, whole person approach to helping women with those symptoms actually feel better. So PCOS is a multifactorial thing. It's not just that your ovaries have an issue. It's not just that your endocrine system has an issue. There's multiple reasons playing into why women get PCOS. And once we talk about the different types of PCOS, that will make sense. But I think PCOS, polycystic ovarian syndrome, is really misnamed, and it's really antiquated with how we name it. And I really wish that we would be on top of changing some of the medical criteria around diagnosis and also changing the name of the condition. Though that type of stuff tends to take a long time when we're talking about a condition that's pretty well stated and researched in the medical literature. It takes a long time for movement for something like that to occur, though there is a possibility that PCOS might be renamed in the future. But I personally would really like PCOS to be named something along the lines of ovarian dysfunction, because when we talk about all the different types of PCOS, that ends up being the problem for that ends up being the problem for most women, is that we need to work on their ovarian health, and then their cycles become more regular. They're able to have babies. Because one thing I didn't mention before is that fertility issues is one big symptom of PCOS. So most women under 35 with a whole year of unprotected sex should be able to get pregnant, but women that are having unprotected sex and are not able to conceive, sometimes that prompts them to go to their physician, who then will diagnose PCOS, and the woman will be having unprotected sex, but it's usually not effective because we don't know what her fertile window is. So we can talk about that in a little bit, because when we're talking about what we do for PCOS, the idea of a fertile window becomes really, really important. So if you are a person that has been diagnosed with PCOS, or thinks you have PCOS, or that where you're infertile currently, and I always say currently because I don't think most women who struggle with infertility should be struggling with it. If you're infertile currently, then some of these things that I'm going to talk about could be helpful for you, especially when it comes down to treatment, because women with PCOS and infertility, they have irregular cycles, so that means it's hard to time intercourse for actually falling pregnant. So teaser towards the end, we'll talk about that. But I want to address now parts of the reasons why women get PCOS. So I personally wish that PCOS was called ovarian dysfunction, because that's really what's happening. The ovaries and the brain are driving all of these signals, or other parts of the body are driving how the ovaries are able to produce their hormones. So while I think ovarian dysfunction is a better name for PCOS, I don't think it's really the perfect name. I'm constantly thinking of a different way to describe it that would be more inclusive. But ovarian dysfunction is the one that I tend to use the most with patients, because I feel like it's currently makes the most sense. So let's talk about the types of PCOS. Because what type of PCOS or what type of ovarian dysfunction that you have will dictate how we treat you, how I will look at your case as a naturopathic doctor, but also how your conventional doctor will work with you. So let's talk about, for instance, the top type of PCOS is an insulin resistance type of PCOS. So these women are typically, but not always, overweight by 20 to 20 plus pounds or more. And they have issues with insulin resistance. So insulin resistance occurs after you have dysregulation in your blood sugar regulating mechanisms. So if you are having episodes of being hangry, if you are having episodes of hypoglycemia, then that will often make your insulin go up and down in order to regulate your blood sugar. But over time, with those insulin surges, you can become resistant to the signal of insulin at the cellular level, and so you won't actually be able to open up the door and let glucose inside to help give your cells fuel. Because the purpose of insulin is insulin is secreted when we eat to bring in sugar into our cells, because our cells need fuel to do their job. So insulin opens the door. But if you're having blood sugar ups and downs because maybe you're skipping meals, or you're a person that tends to get hangry, or you're not eating in the morning, or you're intermittent fasting, or you're an athlete, or you're just not eating the right foods for your body, you can have insulin going all over the place, and then that makes your insulin go up and go down and go up and go down. And when you have a lot of insulin circulating in the system, that makes your cells essentially resistant to the signal of insulin. So they're so used to seeing insulin floating around outside that they're like, oh, why do I want to listen to insulin signal right now? You know, you've been knocking on the door all day. I don't need to actually come to the door and let any glucose in. And so the cells stop to listen to that signal of insulin just because there's so much insulin floating around. So the insulin type of PCOS is probably the most common. Upwards of 70% of cases are insulin resistant PCOS. And this is definitely more common than you would think, especially in women that are not necessarily overweight. So for those of you that are watching this and you're thinking, okay, I have a diagnosis of PCOS, or I was diagnosed with PCOS in the past, or I think I have PCOS and I am not overweight at all, I'm in my good weight range, then that doesn't necessarily exclude you from this type of PCOS at all, to be honest. I've seen people that are thin have blood sugar issues and insulin resistance. I've seen people who are very overweight have it. I've seen people who are very overweight not have it, or at least have it under control in different times. So the way that the conventional medical community tends to treat an insulin issue PCOS is to give you things to regulate your blood sugar. And so one of the drugs on the market for that is called metformin. And metformin essentially helps to bind up glucose in your stool and help you shuffle it out. So in theory, it works really well, but it can cause a lot of digestive upset for people, and it can cause a lot of gas and bloating, especially when we're initiating the medication. And so a lot of people don't feel good on it, and it does deplete nutrients over time, which most drugs tend to do. So it's always something to consider. But the good thing is that there are a lot of natural alternatives to something like metformin. So we'll talk about that in a little bit. I want to get through all of these types of PCOS before we talk about treatment. But the insulin issue PCOS is probably the most common that I see in my practice, and that I see diagnosed by other doctors. And so it's really, really crucial to get your blood sugar under control. Otherwise, you're going to increase your risk for diabetes, especially long term. So whenever a woman with PCOS comes into my office, I always ask her, okay, what are your goals here for treating your PCOS? Is it to get rid of the hair growth? Is it to decrease the risk of diabetes long term? Is it to get pregnant? Is it to establish a regular cycle? Those goals help us determine what we're going to do to treat them. And you know, depending on what their goals are, sometimes that gives me a clue about what type of PCOS that they actually have as well. So insulin issue PCOS, that is probably the most common that I see. And you do not have to be overweight to have an insulin resistance problem contributing to PCOS. So let's talk about the next thing that I see the most commonly, which is androgen PCOS. So this can be ovarian androgen PCOS, and this can be adrenal androgen PCOS. And so what I mean by androgen is a hormone of the male type. That's what androgen means. So this is things like your testosterone, which we as women have, and also things like DHEAS, and also things like androstenedione. Your testosterone and your DHEAS are really, really commonly measured in the blood, And I do this for all of my patients that I'm working up their hormones, as I'm checking these markers to see where they fall, to see if they're normal, to see if they're elevated. And you can have an increase in either testosterone or DHEAS or both, and that can tell us where the dysfunction is. So the idea is that, so let's talk about adrenal androgen problems leading to PCOS. So when a woman is stressed, her body needs to compensate for the stress. And a lot of us are stressed, so we know how this feels. But your body will compensate in a certain way to help you deal with the stress the most. But like everything in physiology, there is a back door, there is a type of biochemical reaction to help save you. There's lots of different ways that your body can compensate, and all the compensatory pathways are not the best to be doing all the time. So, for instance, if we're undergoing a lot of stress, often that will rev the adrenal glands up, and sometimes that will lead to an increase in what's called DHEAS, and the S tells us that the DHEA comes from the adrenal glands themselves. So there's a certain percentage of DHEA that always floats around in the blood. When you're pre-menopause, about 80% of that is ovarian DHEA, and about 20% of that is adrenal DHEA. So we can see the breakdown of adrenal DHEA if we measure it in the blood as DHEAS. So that is a really, really important marker that I'm running on a lot of different people. And then another reason that can make your DHEAS go up along with stress and the adrenal response is when you have stress that's making your prolactin go up, and your prolactin actually leads to an increase in the DHEAS production. So prolactin is a hormone that's put out by your brain, and most hormones sound like what they do. So prolactin, lactation, so pro milk, kind of like if you were a breastfeeding mom, your prolactin's going to be high to help stimulate milk production. Both men and women have prolactin that's circulating all of the time. It's just one of the hormones that's important in the balance of everything in the body, and whether you're breastfeeding or not, you're going to have some prolactin circulating. But if you're under a lot of stress, then your prolactin is going to actually go up. So elevated prolactin can be due to stress, and that ends up increasing DHEAS. So I'm hoping this makes sense. Give me a little heart if this is making sense. So that is one piece of the adrenal PCOS problem, is this androgens. The other part of androgen PCOS is that your ovaries can also make too much testosterone and too much DHEA just of themselves. So this is usually due to the fact that your insulin levels are dysregulated, and that leads to issues with ovulation, because when your brain is creating the menstrual cycle, there's a balance between something called FSH and LH. And FSH preps the eggs to get ready for ovulation, and then LH surges in the middle of your cycle to actually release the chosen one, the golden egg that is going to be released and ovulated for that period of ovulation. So if insulin is going all up and down, that can affect ovulation, and LH will go up. The brain will send out a lot of LH to say, hey, we need to ovulate, and that increase in LH, because the ovaries are not as responsive over time for women that have PCOS, because their cycles are irregular, their brain is really trying to get them to ovulate and have a normal cycle. So LH goes up, and with insulin up, that leads to an excess of ovarian androgens. So you guys can kind of see the biochemistry interplay. And what I'm going to do is I'm going to put a blog up on my website that has this written out for you guys a little bit more easily, so that you can read it versus listening to me explain it. So it will have some text there so you can follow it a little bit differently if you got lost there. I'm looking down at my notes in front of me to make sure that I'm, explaining it properly. Because even I talk about this all the time, and sometimes I have to think, deeply in my mind what's going on. Because it's complicated. Your endocrine system is so amazing, and it does so much for us at a deeply cellular level for everything, for your ovaries, for your adrenal glands, for your brain, your skin. It just has so many different effects. So the biochemistry, if we understand that can help us understand what's going on kind of on a macro level as a whole. So we talked about insulin PCOS, insulin resistant PCOS. We talked about androgen issue PCOS, which includes adrenal PCOS, and it also includes ovarian PCOS. And then there's two other types of PCOS that are more new on the block. The first one is post-pill PCOS. So you can have PCOS triggered by so many different things. One of the triggers is if you're a woman that has taken an oral contraceptive pill, or an OCP, or commonly known as the pill. Once you're on the pill for so long, it essentially chops off all of your brain signals, so your FSH, LH are not talking to your ovaries, and so you're not having a normal cycle. And so once we take that pill away, it can be really hard for the brain and the ovaries to learn how to talk again. And so a lot of women will have PCOS symptoms because their brain is trying to get their ovaries to work, and they're also detoxing a lot of the crappy hormones from the pill, while their own natural hormones are increasing as the body's starting to reestablish a rhythm. So a lot of women will have the male pattern hair growth, acne, they'll feel inflamed, they might be ovulating right away, they might not be, they might have gained weight, sometimes they lose their hair, their cycles are irregular. So a lot of those are the symptoms that women tend to go to their doctor with and get a PCOS diagnosis. So you can see that once we take the pill away, sometimes those symptoms come up, and so we could technically classify this person as having a post-pill PCOS. And this is a perspective that naturopathic doctors will take on and understand, especially those of us like me who are really into the women's health and hormones. But it's definitely not an established diagnosis. For instance, if you go to your MD or DO and say, I think I have post-pill PCOS, they'll probably look at you like you have 10 heads. So don't do that. Listen to this video and learn what to do and implement it, or work with your own naturopathic doctor or natural practitioner. But anyways, I digress. So this type of PCOS is not established in the medical literature per se. We have studies that show that women that go off the pill develop certain symptoms, though we are not, or I should say the conventional medical community is not attributing that to like detox of the pill quite yet. But a lot of us naturopathic doctors see it, and so we treat it. So we help those women that are coming off the pill essentially we help them rebound. We help them not have, a ton of symptoms after the pill. And that is totally doable. It just takes a little bit of detective work. But post-pill PCOS, it has a variety of symptoms like I just listed, but we end up doing a little bit of symptom management, to be honest, but we're usually looping in some of those treatments for high androgens, high male hormones, and insulin issues. But there's also a detox issue with these women. Sometimes they have had a lot of their B vitamins, like folate, depleted by the birth control pill. And so we need to replete those so that all of their biochemistry can wake up, so that their liver can function properly with detox. So I usually will always loop in some liver support with those women. But the post-pill PCOS group, they tend to have similar treatments, sometimes interwinding along with the insulin PCOS and the high androgen PCOS. So they get a little bit of all of it depending on what they have going on. And then there's a fourth type of PCOS that I would say is probably the least amount of cases that I see in my practice. And it would be the inflammatory PCOS. So you can have inflammation that induces dysfunction in your ovaries so that you have anovulatory cycles, you have irregular cycles, and you can get lots of different PCOS symptoms like acne and male pattern hair growth, hair loss, different things like that. So inflammation can increase androgens. So most cases of PCOS have some androgen male hormone component that we have to look at. For the people that have the inflammatory type of PCOS, what I'm really saying is that there's some sort of inflammation, there's something wrong in their body that we need to go find out what that is and treat that. And then that will help their PCOS type symptoms. So I don't like saying you have inflammatory PCOS, because that's not necessarily a thing. It's more so that you have an issue, whether it's an undiagnosed food allergy, or you have a gut problem, or you have an old injury that hasn't healed, or you have an infection, just different things that lead to having wonky cycles that resemble PCOS, but the PCOS is not actually a thing, it's not the problem, it's something else that we need to treat. So I hope this makes sense. I'm seeing that you guys are following along, but I can't see like anybody's names on here tonight, which is really weird. So I don't know if the video for Instagram is changing their methods, but I can see you guys. Can someone pop a question in there and I'll see if it pops up? Ask me anything. If you've been asking questions this whole time, I haven't seen them, which is kind of weird. Let me see. Can you guys see this? Pausing our standard video time. I don't know if you guys can see that. I think Instagram might be a little bit weird, but the live has been a little wonky tonight. Okay, so that's good to hear. But this will be reposted, so those of you that had a wonky connection, then, oh good, you can see it. Okay, great. Yeah, I wasn't seeing, perfect. I was not seeing anybody even pop in, though I was seeing the count of people. So it was weird, because usually I see people join the channel. So maybe Instagram is changing settings. Anyways, let's move on. So I hope this is making sense. We talked about what PCOS is. We talked about symptoms that women that have PCOS commonly experience. And I wanted to talk about that specifically because a lot of women think that they have PCOS, but they don't actually have PCOS. So you have to get a proper diagnosis if we're going to actually treat you and heal you and fix your hormonal problem. Because women can have a variety of hormonal problems, but we have to know which one it is to go after it, to get rid of it. We talked about all the dysfunctions that can lead to PCOS. So high androgens, issues with blood sugar and insulin, issues coming off of the pill, issues with inflammation, and those can all create PCOS-like symptoms. And I would just rather prefer to call PCOS ovarian dysfunction because I feel like that's much better a descriptor. But again, if you're a woman who thinks you have PCOS and you tend to have a lot of pain with your cycles, it's less likely that PCOS is going to be your issue, though some women with PCOS do have hard periods. So that can be another discussion. Let's talk about treatment. So let's talk about, first of all, treatment for the most common type of PCOS, which is the insulin resistant type of PCOS. So Standard medical care for this is diet, exercise, and metformin. Though metformin doesn't help you if you don't, how should I describe this? Metformin doesn't help everybody that has an insulin issue PCOS, because metformin works on metformin essentially works by lowering your blood sugar levels. Great question. Favorite herbs for PCOS. We'll talk about that in a second. Metformin essentially lowers your blood sugar, but it doesn't act on insulin directly. So when I'm treating women that have an insulin issue PCOS, one of the first things that I'm doing is, of course, running blood work. So no matter what type you are, I'm running a whole hormone panel. A whole hormone panel has estrogen, progesterone, DHEA, cortisol, testosterone, testosterone-free, prolactin, sex hormone binding globulin, FSH, LH. So it's really, really comprehensive. It has everything. So we can look at that and say, okay, what is your system producing in this moment in your blood? And then for a certain subset of women, I will sometimes do what's called a Dutch test, which is a urine hormone test that looks at excretion and use of hormones, which is really, really important, because sometimes we can see what you're making, but we can't see what you're doing with what's made. And sometimes women don't have an issue making stuff or having enough hormone, they just have an issue with the actual clearance and detox of the hormone. So if we're not doing metformin, one of my favorite ways to help women who don't want to do metformin or have blood sugar issues with PCOS is to do berberine. So berberine is an herb, and it's a great herb. It helps with your blood sugar. It also helps with the gut and clearing out any gut infections. But berberine, they've done studies comparing berberine and metformin, and they found that berberine, 500 milligrams 3 times a day, is pretty much the same as a similar dose of metformin, which is huge, you guys. I mean, berberine is a cheap herb. It's very sustainable. It's easy to make, and most people tolerate berberine really, really well. So you can do berberine 3 times a day, 500 milligrams, and that works really, really well. For all of this treatment information, you guys, I would definitely clear this by your naturopathic doctor. Do not self-treat on this. Talk to your healthcare practitioner, because they're really going to help you determine if this is the right approach for you or not. Because when you're in it, you can't sometimes see it as much. So definitely run everything by your actual practitioner that you have on the ground. That helps you. But berberine is one of my favoriteest things. I'm always typically giving these women chromium as well. Chromium is a mineral that essentially helps insulin act when it gets to the cell. So it makes insulin more effective at docking on the cell and letting the glucose into the cell. So chromium can really help anything related to blood sugar. Like, when you feel a little shaky, or you feel a little hangry, or you have episodes of hypoglycemia when things are going up and down with your blood sugar, or you're before a meal and you feel a little spacey, chromium is really good for any sort of blood sugar symptom. And so I'll often dose it multiple times a day, and chromium's dosed in the microgram amount. So, and it's just a mineral, it's very safe. And it's included in lots of PCOS type blends and formulas. So it can be a great addition. Sometimes I will give people extra chromium, and I find that really helps. So chromium, biotin can also be really helpful for insulin and blood sugar levels. So I have this one product that I really like called Diaxanol. I think I'm pronouncing that right. It's by Orthomolecular, and I use it in a lot of different PCOS patients because it specifically helps decrease insulin that's floating around. But I will only give this to women that have high insulin on a blood test. So it's not for everybody. And with all of these, you have to make sure that they're perfect for your exact case. So these are some ideas that you can talk to your doctor about. I also really love inositol pyroinositol, myo-inositol for PCOS. Really, really helpful. Usually I usually give a powder because it doesn't taste like anything. It's a white powder. It goes into a smoothie or water, and it's really well tolerated. And it's usually dosed in the teaspoon amount. So I'll give that for a couple of months, and that really helps to nourish the ovaries and helps with the insulin response. So that's one of my favorite things for PCOS. It's not an herb, but it's really fantastic. Let's talk about, so those would all be things that would be really supportive for women that have an insulin issue PCOS. For women that have an androgen-specific PCOS, I'm often giving things that are helping to promote androgen clearance, or helping to down-regulate any sort of 5-alpha reductase, which turns your testosterone into a more inflammatory type of testosterone. So these are things like saw palmetto, which is an herb. These are things like pygeum, which is an herb, and this is things like nettles, which is also an herb. And I have a product that will often combine all three together, which is awesome. But saw palmetto is great. It's a super sustainable herb. It grows natively like all over Florida. It has no sustainability issues, which I always think about, especially when we're giving high doses of herbs long term. The source of the herb matters. So, nettles grows all over the Pacific Northwest. Saw palmetto grows all over the Southeast. I'm talking specifically about America here. And then like pygeum is an herb that's not as sustainable, and it's grown in Africa, and it's just not as sustainable as the other one. So I use that one a lot less. But those three are probably my favorite for helping women with testosterone clearance and modulating androgen levels if you have an ovarian androgen issue or if you have an adrenal androgen issue. Is this all making sense? I know I'm talking really, really fast. I get excited about this, so it comes off that way. So what else would I talk about for the adrenal piece? If you have an adrenal androgen PCOS, you have to treat the stress. So number one, look into your lifestyle and find the stress. Is it your husband driving you nuts? Is it there's not enough time for yourself because of the kids? Is it schoolwork? Is it work? Is it some emotional stressor that you have in your head that nobody knows about, that you don't talk about? Is it some past trauma? Is it something you're worrying about? I mean, this could be any sort of stress, whether it's mental, emotional, physical, spiritual, whether it's physiological stress in somewhere in the gut or somewhere else in the body that goes undiagnosed. Any sort of stress can activate an adrenal response and cause things to go a little haywire. So I'm always looking at lifestyle first, because you can't out-supplement yourself from stress. So lifestyle is number one for any type of stress. But what I will also give along with people that are working on lifestyle for stress reduction is what's called adrenal adaptogens. So adrenal adaptogens are herbs that help your body adapt to stress. That's why we call them adaptogens. But they're really great because some herbs are naturally more warming and more stimulating, and some herbs are naturally more cooling and more calming. Some herbs are neutral. Some herbs work in the background to stimulate your hypothalamic pituitary ovarian axis. Sometimes the herbs are helpful to modulate your hypothalamic pituitary adrenal axis. So depending on what the adaptogen is, that is what I will give for my PCOS patients, but it's very particular. For instance, rhodiola is a really great adaptogen, but rhodiola doesn't go over as well as other adaptogens because it can be really stimulating for some people. So some people, I think, need the stimulation, so I'll give them rhodiola. Some people are sensitive to rhodiola, so they feel stimulated by it. But sometimes I'll give it to someone for the specific hypothalamic pituitary ovarian axis support, and they don't end up doing well on it. So the good news is that there are lots of different types of adaptogens to use. I was just picking on rhodiola for the example. But some of them are very stimulating, some of them are cooling, some of them are nervine, so they help you feel less frazzled in your nervous system. Some of them help support thyroid hormone production. Some of them have different energetics, so they're very grounding. Some are more stimulating and key you up. So I pick the adaptogens depending on the woman sitting in front of me. So if you are a really chill person and you feel really stressed and maybe you don't feel connected to your stress, then I'm probably going to give you something that could be a little bit more stimulating. If you're somebody that tends towards anxiety, then definitely I'm not going to give you a stimulating adaptogen. I'm going to give you more of a calming adaptogen. So it depends on the person sitting in front of me, your medical history, and what type of PCOS I'm treating, and what other things you have going on in your medical history. Help me pick which type of adaptogen. So lots of different adaptogens. Rhodiola is one I picked on. There's the 2 types of ginseng, Siberian ginseng and American ginseng. I believe there's an Asian ginseng. So Eleutherococcus and Panax ginseng. Really, really great. What else would I talk about? Ashwagandha. Love ashwagandha for so many things, but ashwagandha would not be great for someone that is having an androgen issue, that has too many androgens, because it can help to boost that pathway. So you guys can see how you really got to tailor it for the person. If we're talking still about stress-related PCOS or having an androgen adrenal issue PCOS, having an adrenal PCOS, I should say, then I will usually always incorporate some sort of B complex with these people, because B vitamins help to support all of those stress pathways, and you need all of them together. You need all of the Bs together in a complex to see an effect, because it's kind of like eating an egg. You want to eat the whole egg and not just the yolk and not just the whites, because an egg was designed to be eaten together. That's my philosophy with B vitamins as well, is you want the B vitamins to go together. You don't want to take mega doses of B12, and you don't want to just take mega doses of B1 or folate. You want to take it all together. And I usually will loop in electrolytes for my stressed adrenal issue PCOS patients, because most people that are stressed are low on minerals, because minerals come from your food, and minerals are like very, very, very tiny rocks, and rocks are very hard to digest. So minerals are on the treatment plan for a lot of people, but they can also help with any sort of anxiety that's coming up during this time when we're balancing hormones. Let's talk about just, straight up ovary support for PCOS, because I really do believe that PCOS is more ovarian dysfunction that is created from so many different types of outside factors. So there's lots of minerals like zinc and magnesium, amazing for hormones and really important for the ovaries. There are one thing that's been my favorite lately is dosing beta carotene for the ovaries. The ovaries have a really high concentration of beta carotene in them, which is necessary for the egg storage and the development of follicles. And so some ovaries just don't have enough beta carotene on board, so they can't have a healthy ovulation response. So beta carotene I will use. I will often use Vitex with people that have irregular cycles and we're trying to improve ovulation, or we're trying to shorten a longer cycle, a 35 plus day cycle. So that can be really helpful for women. Vitex is really supportive for the ovaries, and just the whole axis between your ovaries and your brain. But Vitex needs to be dosed very specifically and shouldn't be used long term. And I see a lot of women come in and they've been on Vitex for years. But Vitex, I use it for 3 to 6 months, usually around 6 months. And then we back off and we let the body do what it needs to do. Usually, again, with supplements, the purpose is to use them for a short period of time to supplement you, not replace anything, and then we can establish function again. So Vitex for a short period of time helps to establish function, helps to get things more regular for cycles. What else? Another thing that can help with cycle regularity is, of course, eating delicious food that is not processed and is whole foods based. But in that, I like to have people do what's called seed cycling. And seed cycling is great for the woman who has no real rhythm for her cycle and is trying to get a rhythm back. So this is great for the type of woman who has really, really long cycles, or who has no idea what's going on with her cycle, and doesn't know, if she ovulates, when she's going to bleed next, really what's going on at all. I'll have them seed cycle. And that can be really helpful because in the seeds and oils that you cycle with, some are more estrogenic naturally and some are more progesteronic naturally. So they help to stimulate more of an estrogen state, or they help to stimulate more of a progesterone state. And so if a woman has no current rhythm, or wants to further help a rhythm that's establishing, or to make a rhythm more regular, then you can seed cycle. So seed cycling is using things like sesame seeds, sunflower seeds, evening primrose oil, fish oil, pumpkin seeds, to help create a rhythm. Other things, sometimes a woman will have issues having a lot of estrogen around with PCOS, and so sometimes I will use liver support, things that have DIM in it, sulforaphane, calcium D-glucarate, depending on what we will find on a Dutch test for these women. But one thing that I see for a lot of PCOS patients is that they're really benefited by B vitamins and going dairy-free. So dairy-free is when we remove any sort of dairy that comes from an animal. So this can be cow dairy, but sometimes we need to remove like goat dairy, sheep dairy, camel dairy, all of the dairies. But for starters, I have women go fully dairy-free, and then sometimes we'll loop in like a goat cheese or sheep's milk or something like that, and they can tolerate that. But I find that removing dairy helps with a lot of symptoms for PCOS women. So I will often remove that, and sometimes that's so helpful for women because it's removing an inflammatory food, which, as we were talking about earlier, inflammatory PCOS, which is inflammation from another source causing irregular cycles. You guys, oh, there we go. If we remove those inflammatory foods, then we're removing some sources of inflammation that way. So someone made a comment, yeah, huge difference in my cycle when dairy is present and when it's not. Yeah, I mean, I see this with so many women, and sometimes I see this in myself, I'm not gonna lie. And I'm, I don't really have too many things to complain about on my end for my cycles. So definitely try that out. It's something that you can experiment with yourself at home. Of course, ask your doctor if you, before you should do anything that you read or see or hear about on the internet. But it definitely is one of those very benign things that you can do, is just, I would say give it 2 to 3 months of removing dairy so that you remove all those inflammatory molecules and decrease the inflammatory cascade, and give it several months to work, because with a lot of these natural supplements, it takes some time for it to really get into your system and for it to trickle down to the ovary level. So whenever we're initiating a different treatment, I'm always recommending to my women to let's do this and let's commit to it for 3 months, because in 3 months, that's when we're going to see the change. Sometimes we initiate something and we see the change pretty immediately, which is awesome. But sometimes it's around the 3rd cycle mark when we're like, oh yeah, that makes a big difference. So if you are doing a PCOS treatment program, or you're working with someone and you're not quite seeing results, definitely I encourage you to wait until that 3-month mark, because that will make a really big difference with how the treatments, work. You have to wait, you have to give it time. The last thing that I will say for PCOS is sometimes I will give women progesterone that have PCOS, that have a lot of PMS symptoms, or that really just need a higher level of extra support, though this takes work with a quality trained naturopathic physician that knows what they're doing in order to do this, because progesterone with PCOS is definitely not for everybody. It's only a specific subset of people, but you can give natural progesterone to help balance out some of those symptoms and help. So it really just depends on the person. So we just got finished talking about treatment. Tonight we talked about PCOS and everything about it, the common symptoms. We talked about all the dysfunctions that lead to the different types of PCOS. We talked a little bit about the biochemistry, and the biochemistry I'm gonna post on a blog post on my website so you guys can read a little bit more, because I did kind of surface level explanation, but it will be there for you to read so you can really understand what's going on. drmegnd.com/blog is where you can find all that info that I post after these videos. So I'm gonna open up the floor for any questions if you guys have any. Lots of people stayed on tonight, which is fantastic. If you're new to these videos, I'm Dr. Meg. I do these videos every Monday night at 5, and I'm a naturopathic doctor in Southern California. So if you need a naturopath and you are in California, then we should chat, because I do virtual visits all over the state. So you don't even need to be in my neck of the woods to consult with me. So if there are no questions, I'm gonna sign off, and just send me a DM or put a comment later when this is posted if you guys have questions, and I will answer them to the best of my ability. And thank you all for joining me. It's always so fun, and I hope I answered some of your questions. I was just looking over my notes to make sure that there's nothing I wanted to answer that I didn't already. And there were a couple of things that I mentioned in this video that I know that I kind of teased you guys about that I'm gonna have to go back and do a separate video on. Probably I'll do a video next about how you do basal body temperature tracking for PCOS and for natural birth control and for figuring out what the heck is going on with your hormones in your cycle, because that can be really, really helpful. Most women that I treat with PCOS have issues with fertility in some way, though that doesn't have to be the case long term. But that is definitely a perpetuated idea when a woman is diagnosed with PCOS, is that they will have issues with fertility no matter what, and that is 100% not true. I see women with PCOS get pregnant. It's just a matter of fine-tuning some things. So I'll do a different video about that. So good to see you guys tonight. Thank you for hanging in there with some of the connectivity issues. There must be a lot of people on Instagram right now because I've got all the bars, so service bars. So thanks guys, and we'll see you again. Bye.